So I'm Mark Travella, Associate Director of Transformation for ePut.
We've been talking, Mark, with the wider services about how the voluntary sector can get involved in supporting the delivery of mental health services in Essex.
We've had lots of discussions with the voluntary sector here in Mid and South Essex, but other parts of Essex. And that is that how do we integrate more so that people's health and social care and wellbeing needs are met in their entirety? So how do we have more longer term joint working so that people don't experience a sudden ending of services, which I think really worries our patients, our carers, our staff and GPs. So I think what's going to be really exciting over the next year is us exploring new ways of working together, practically, contractually.
And what difference do you think that'll make to our population in Essex?
They'll get a better service because they'll get a sense of continuity of service. GPs, patients, carers and our staff, they'll all feel that it's much more safer and much more appropriate. And I think by working more as one system, you have a much greater sense of improved experience.
Yeah, and certainly our discussions have been about the added value that the voluntary sector can bring. We can do stuff differently. We can do stuff potentially cheaper than the statutory services.
What secondary care is very good at is providing clinical services, nurses, doctors, OTs, psychologists, services like that. But actually what we're not best at is looking after people's determinants of health, and that's people's well-being in the longer term. People's lives still got to run. People have still got to look after their children, their families, their home, their financial situation, balancing work. And that's very difficult when you've got a mental health problem. We need the voluntary sector as partners that can do certain things that we can't.
And of course, as we've seen with the Healthy Mind Service, with the Recovery College, growing together the wider sort of support services, we can kind of come at things in a different angle and support people in a different way.
Yes, all those services are amazing and we already use them as best as we can. But what we want to do is improve on that and have a new tier of service as well, led by the voluntary sector, that fills in the gaps that frustrate people, worry people at the moment.
So getting in there with inpatient services, with secondary services, those clinical services to give people a different level of support.
Yeah, absolutely. People need to have the confidence that organisations are working together for people's long-term health, social care and wellbeing needs.
Brilliant. So exciting times for the mental health system in Essex.
Yes, supported by national policy.
Brilliant. Thank you very much, Mark.
My pleasure.